Good morning and welcome to the Health and Social Services Committee. I'm going to start out with the call of the roll. Okay, and just state that we just have quorum, so if any member has to leave, we'll have to take a recess for that point in time. Is there any declarations of pecuniary interest? Hearing none, I'm going to move to the adoption of the minutes for Health and Social Services from May 9th. Move it, Councillor Brenner and Mayor Carter. Any questions? Any opposed? We have no statutory public meetings. I'm going to ask for a motion to amend the agenda to allow for delegations to go first. Chair Henry, seconded by Councillor Brenner. All in favor? And that is carried. So I'm going to call upon the delegations for today, and it's Eva Reedy. She's the chair of Hospice Whitby, Roger Anderson House, and she's here in person. Good morning.
Good morning, everyone. Thank you. Just want to give you a quick update as to where we are with our project. So on May 16th, we went back to tender on our Hospice Whitby Roger Anderson hospice build. May 28th was a mandatory site visit from any of the pre-approved contractors. We anticipate the tender process closing at the end of June, probably early part of July, and then providing that the numbers meet our budget this time, then it'll go to Ministry of Health for approval, and then we will begin construction immediately. So we're cautiously optimistic that the contractors understand our budget issues, and we will be able to build this year. So you'll see on the screen actually the our site plan, if it can be maybe focused in on the actual building. Just to give you some of the updates that we made or changes we made since our very first iteration, we've added private patios outside each of the 10 bedrooms. We learned during COVID that hospices that did not have private patios had a significant reduction in number of people going into hospice, because with the visitation restrictions, people wouldn't go to hospice if their friends and family members couldn't be with them, which is completely understandable. But also, I think just for anybody in hospice, when you're lying in bed and you're dying, the opportunity to have the patio doors opened and your bed moved outside so you can enjoy some fresh air is a significant benefit to everybody involved. And through our research over the last few years, we've heard about so many stories of people in hospice who have lived their lives outside. Farmers will have their horse brought to the hospice so they can visit. Just laying outside in the bed. Many people actually want to die outside because that's where they feel most at peace. So we chose to add patios, and you know, everything costs money, so what we did was we flattened the roof to kind of balance out our budget. And also on the north side of the building, we were able to close off that north entrance because we now have 10 additional entrances into the building, and we were able to save some money in that way. And then we also changed the vestibule so that it's double doors to prevent the cold air coming in with only one set of doors. We've learned a lot since we began our hospice project. And even just talking to people who have lost members of a family in a hospice versus people who have had family members die at home or in hospital, there's a huge difference in them being able to even talk about it. People who have been to hospice really have a sense of peace and calmness. They're sad that they've lost their family member, but they know that they've got the best possible care because it's 24/7. I recently researched and I found at least 54 hospices around the province of Ontario, from 2 beds in Tiverton to 20 beds at Maison McCulloch in Sudbury. And we are long overdue, so we're so happy that we have support from our region, from the province, more importantly, from the members of our public, and increasing support from West Durham, because this will be the hospice that people from Ajax and Pickering will also be coming to, although everybody in the region is welcome. It's open to everybody. And if any of you have seen our postings on our Facebook page, or if you've been to any of the other hospice websites, although people are going there, they will die. But it's a quality of living until that point. All kinds of things that happen in normal life at your home or anywhere else are also happening in hospice. Just recently, we posted a gentleman in Newfoundland. He just wanted an old-fashioned lobster boil. So the volunteers and staff set it up outside, and you see him all bundled up, and there's a lobster boiling in the can on the outdoor fire. We've seen pictures of weddings, christenings, birthday parties, and who knew when John Rycroft joined our team in 2018 as our treasurer that he would be celebrating his 37th wedding anniversary when his wife Mary was in hospice in Grimsby. John packed up the family china, silverware, took everything to the hospice, and the staff set up the table outside. They had a beautiful family dinner outside, candlelight, and John had the meal catered. So they were still able to celebrate like normal people, although Mary was at the end of life. I think that's about it. We're very happy with the new design, and I will be back again in the fall to give you some final numbers, and I thank you again for your support.
Thank you, Eva, and thank you for the update. Is there any questions? I'm seeing none here and seeing none online. I just want to compliment not only yourself, but the board and everybody involved over the years that have been working so hard to bring to fruition what hopefully the numbers play out, and that we will be celebrating and moving forward in the opening of this place that many have put a lot of work into, including yourself. So thank you very much.
Thank you.
I'm going to now go to presentations, and I'm going to move to 5.1, and I'm going to turn to the Deputy Chief, Jake Savanda.
Good morning.
Good morning.
So I'll be presenting on behalf of Troy Cheeseborough, who's away at the Paramedic Chiefs of Canada conference. Just provide you with a brief paramedic service update. So our call volume for 2023, January till December, is up on the board. We've done a total of 148,292 calls. What's significant about this is that 51% of these calls are classified as a Code 4 responses, which means lights and sirens, potential life threat. This is going to change significantly about a year from now, as our Oshawa dispatch, who dispatches all of Durham region, is going to be undergoing a change in process where they're going to be identifying calls based on a priority and give them a lot more leeway to assign the right crews to the right calls. Our call volume for January to March for this year continues to be slightly down. But if we look at the overall projections for this year, it looks like we're going to experience about a 2% increase in overall call volume. Call volume, this just kind of shows that the first 3 months we're like right on track compared to what we were last year, and our Code 4 calls tend to be the highest overall numbers. Our offload delay numbers for most of the Durham region, the most utilized hospitals in Durham region, Lakeridge Health Oshawa and Lakeridge Health Ajax, our average offload is 55 minutes and 34 seconds at Oshawa and 44 minutes, 51 seconds in Ajax. This continues to be some of the highest numbers in the province. Offload delayed, if we remove the 30 minutes, which is expected for transfer of care, on our monthly basis, offload delay continues to be high. And if we look at the total hours lost, we have 9,847 hours, which if we calculate our special event rate to these hours, would cost us $1,949,768 in lost funds. CTAS response, we're unable to meet our CTAS, sudden cardiac arrest, and our CTAS 1 responses based on threshold that's been approved by the province. Primarily, this is due to the challenges with our offload delay and limiting our resources to get to the calls. Like I mentioned earlier, our CTAS reporting will change with the MPDS dispatch systems. And as you know, like our sudden cardiac arrest response times is 6 minutes or less 60% of the time. And for our CTAS 1 calls, it's 8 minutes or less 75% of the time. An update for our Seton paramedic response station. So this picture is from about a month ago. It has progressed a little bit in the sense that it is now the exterior brick has been applied, and I think our signage is on there identifying what the building is. But it does continue to move along slowly, continues to experience significant delays, and our current occupancy projection is for the fall of 2024. And then just a brief overview of our primary care outreach program. So the advanced care paramedics help support wound care management, wound care antibiotics in the field, and antipsychotic injections and medications to assist for patients requiring support to adhere to medication regimes. We're in the process of onboarding withdrawal management support with the guidance of an addiction specialist doctor providing Suboxone orally and to help with withdrawal. The team is all over our region and helps support allied services from Ajax, CFOC, Whitby, 1635 Dundas, and the Mission United Medical Clinic in Oshawa, as well as encampments and microhomes. The team provides care all throughout the region 7 days a week from 8 o'clock to 6 o'clock at night. And for our primary care outreach program, as you can see from the numbers, it continues to be a vital part of our organization. The region has added a lot of outreach teams in 2024. However, primary care outreach program is the only medical team supporting the community and encampments. As the team continues to evolve with wound care, withdrawal management, the need for medical in this population is going to continue to rise. And lastly, for our opioid updates, Durham Region Paramedic Services have responded to 302 suspected opioid-related overdoses in the region over the year, with majority of them come out of Oshawa. And that's all I have for you, unless there are any questions.
And thank you very much for the presentation. I have Mayor Carter.
Morning, Mayor. Madam Chair, thank you very much for the opportunity to be able to ask some questions. Good morning, Deputy Chief. Good to have you here this morning. The primary care outreach program has been quite successful. You're pleased about how it's progressing, I presume?
Yes, thank you for the question. And through the chair, yes, like we're very pleased with the program, and we continue to get support from all across the province and being recognized as one of the best in the province.
What would help the primary care outreach program in regards to, I noticed that the amount of care that you're giving individuals, but all of them are on an increase. What would benefit that particular program?
Unfortunately, I can't answer that for you. I'm not very much involved with the program itself, and the people there are not present.
Opiate updates, and I appreciate your frankness, so thank you very much. The opiate update, you're the Deputy Chief of EMS, and when I look at the charts, the question has to be asked, why do you believe that Oshawa has 4.5 times more opiate-related overdoses than any other community across the region of Durham, when our population is not 4.5 times larger than Whitby or Ajax or Pickering? So do you, in your professional role, do you have any idea why these numbers would be so high in one particular geographic area?
Thank you for the question. I'm going to try to answer this through the chair. I don't have a lot of experience, but being on the road for over 30 years in Oshawa, I've always noticed that the population and the support for this population was always better in Oshawa than the surrounding areas. And the only thing I can think of is just people gravitating to Oshawa where the support is available.
Okay. Thank you, Madam Chair.
Chair Henry.
Thank you for the presentation. On the overdose list, how many of the patients that you've attended to have overdosed more than once?
Thank you for the question. I don't have that answer in front of me. It's data we would have to look into.
So following up on what Mayor Carter said, we know that there are a number of people that are a constant challenge for all of our medical community, including paramedics. Do you track that information?
I believe we do.
So, not to put you on the spot, and feel free not to answer this question, but if somebody overdoses once, that's a problem. If somebody overdoses twice, that's a real problem. 3 times is a habitual problem. 4 times, it's a care issue. When do people that have overdosed 10, 12, 14, 15 times get the care that they need versus being put back on the street? I know the answer. I think you know the answer. I know Mayor Carter knows the answer. You don't have to answer it,
Thank
but
you.
I can answer it. The answer is they're just put back out on the street.
Yeah.
And the system is set up for failure. And I know Mayor Carter and Mayor Roy, Mayor Collier, well, all members of Regional Council, including myself, advocate for a change in the system. But the failure of the system to deal with the challenges of the few that take the resources away from the many. And that is a problem, and that's not something the region of Durham is going to solve. It's going to take a higher level of government to say, okay, you've done this so many times, now you're going to get the help you truly need. And I don't know how you do that, but the burden onto, the cost onto municipalities, this is my rant and I'll stop. The cost to the communities across this country, not just Durham region, to deal with the challenges of addiction, mental health, and homelessness are going to bankrupt municipalities across this country. The financial impacts are so great, and it's a problem where there is no level of government other than the municipal government that deals with the frontline challenges that wants to take this on and find a solution. Now, the little bits of money that we get from the other levels of government to deal with this is their way of saying, here, this will solve your problem. It doesn't solve the problem. It doesn't even keep up with the costs of the challenges we're having. I don't know what to do next. We don't get answers from the federal government. The prime minister, the leaders of the opposition don't want to talk to us about, and we're not the only region. They just don't want to talk about the issue at all. And for the work that you and your teams do each and every day, for our police and our firefighters and our frontline healthcare workers in emergency rooms, they do awesome work. But we know the number of people that are there more than once, and somebody's just got to sit down one day and say, we got to have a better way than dealing with people that have that kind of problem. And the challenge is that, you know, a very small percentage of the population are taking 20, 30, 40, 80% of your time to deal with when the rest of the communities aren't getting that time. That's just wrong. And, you know, I'll say that, but, you know, we don't have really a media source that's going to print what I said. You know, the national television, they don't want to talk about it. It's a shame, Madam Chair, and I do know that there's a federal election that will happen sometime, and I hope this is the #1 issue during that election. But my last part of the rant, it's amazing though, when a car is stolen in a community, you can have a national summit on automobile theft, but you can't have a national summit on mental health addictions and homelessness, which by far exceeds the cost of the automobile. Now, the increase in all of our insurance is being paid for by us for car theft. But mental health and addictions is being paid for by all of us in our property taxes. And that's not how you fix this.
I just got my rate increase of $500 more per year because I have one of those vehicles that's on the list. But Chair Henry, thank you for your comments. And I don't know what the solution is because you keep talking about it and talking and talking and talking and nobody's listening. And Mayor Carter, next.
Madam Chair, just for information, our data from last year is 505 overdoses. in the city of Oshawa. Our estimated cost that we're absorbing locally is between $3 and $5 million that we're absorbing locally to be able to deal with this issue. What I can tell you, Mr. Chairman, is at the Ontario Big City Mayor's Caucus that is coming up, I think within 12 or 13 days, this will be the issue, and there is 28 of us that are representing 80% of the population that I believe that the sense in the room is that this no longer is an item that can be passively addressed, and that I believe that there's going to be a very aggressive, not only campaign, but strategy to be able to deal with this issue. So I know that we can't, Madam Chair, you know this yourself, we just can't continue on this path. To the question of the regional chair of repeat individuals, we estimate that around 63% is a repeat individual, and that's sad. And there was a great podcast by Thea Raya on the Toronto Star, and she interviewed Danny Williams from Alberta, the health minister there, which a lot of people disagree with his approach. But there was an interesting wording that he uses, compassionate intervention, and that's how they're describing it. But if you've got 63% of repeat individuals that are overdosing time after time, at some point there has to be an intervention to be able to save one's life, to be able to get them into the right care at the right time. And so I just thought I'd add that comment. So thanks, Deputy.
Thank you. Mayor Carter, is any further? So I had the opportunity to do the ride along, and and just for privacy as well too, I won't, I'll make sure I'm careful on what I comment about, but there was identification as we were driving around in the different areas, municipalities, and it just wasn't strictly to Whitby, but the repeat offenders were identified as we drove along. And the numbers were astounding because they weren't just 4 or 5 in terms of the number of repeats of ODs. It was, in one case, hundreds of times, and that's not a good situation. For the, and I'm sure you don't have this information now, but for the individuals that have been like serviced and supported for ODs, how many are housed or unhoused?
Yeah, I'm sorry, I don't have that information.
No,
I can easily get it.
Yeah. So, like, and I didn't think you would, but it's like we need to be looking at the whole picture of all this and what is taking place, and it's all the supports and everything. And I don't know, Chair Henry, if it's like, you just send another letter again. We send another letter to the federal government, and you know what? You got to be heard. It's got to be, and if we're doing it through Ontario Big City Mayors as well too, it's, I know it's very frustrating to get silence back, but it's like, you know what? The individuals on the street don't vote either. That's a big part of the problem. Their families do, and we hear from it every single day as to whose son and daughter, spouse, relative, nephew, is on the streets, and it is families of our community that needs to be recognized as to who is there, and I hear it every single day, and it's quite the struggle as well too. I want to go back to the offloading and that number as well too. So we're talking about $2 million that we're seeing where with the offloading, that this number just seems to have gone up again. And what is the relationship with Lake Ridge Health? And I think this more directly to, because I know your conversations, Chair Henry, have been to Lake Ridge. What are we doing about this?
So thank you for the question. This is, sorry, there's been a busy week. I believe it was Tuesday that I was in a Ontario Health Network meeting, and Matt Anderson was there, and I raised it, the topic of mental health addictions and homelessness, and offloading delays, and got a commitment at least for Matt Anderson to come to Durham Region here and talk to us about some of our challenges. We're coordinating that date right now, and I will make sure that you're invited and Mayor Carter's invited to that meeting.
Appreciate that very much. And lastly, and this is a positive note, I had the opportunity last week to host a town hall with the staff members of the town of Whitby, and we held it over 2 sessions, morning and afternoon. When I did my talk at the Chamber of Commerce and spoke about everything that was taking place, I mentioned the PCOP team. So we were asked to bring the PCOP team in to educate the staff of the town of Whitby, and it was a great session and very well received. And if there's ever an opportunity to have a similar type of format set up to the sharing of the day in the life and sharing to the staff members who are your front line, who even yesterday morning I did breakfast with our ops staff members, and they spoke about the homeless on the street, and they know who our homeless on the street are, and know them quite personally, and it's creating that connection and that bigger support around of like, okay, now we have this opportunity where we know about the PCOP team, we know about the outreach team, and this is where we can bring in the supports for those who are on our streets. But thank you for everything you do and for what our paramedics do. I had the great opportunity to attend to the graduation just over a week ago, and I will say that half of the graduates were women, which was very, very encouraging. But I know that we need to grow more in terms of the numbers for our paramedics in the community as we grow as well too, and the needs are growing as well. So thank you very much.
Great. Thank you very much.
So before we turn to 5.2, I just want to identify that the month of June is an exciting month with the opportunity to celebrate our many Durham residents, a time for us to take a pause and acknowledge the history and contributions and values of all our citizens. Today we celebrate and acknowledge Seniors Month, National Indigenous History Month in Canada, and Pride Month. Seniors Month is a time for us to celebrate the amazing seniors in our life. This year, the month celebrates Working for Seniors, a time to extend our appreciation for all their contributions and hard work. We are fortunate today to hear 2 presentations on important programs geared to our Durham seniors in honor of this important month. And for National Indigenous History Month in Canada, this signifies an opportunity to learn about the unique cultures, traditions, and experience of the First Nations, Inuit, and Métis. And lastly, Pride Month is an opportunity to celebrate diversity and the 2 LGBTQIA plus community and celebrate a Pride Durham community. A time to raise awareness of the importance of acceptance and inclusion of Durham Region. And lastly, on that note as well too, I had the opportunity, and it was the first time for Whitby to participate, but we did with our staff, myself and one other counselor, did participate in Pride Parade in Ajax on Sunday, and the reception was amazing. But too bad Ajax isn't here, but next year Whitby is going to challenge Ajax in their float in the parade. So I'm going to turn to 5.2, and I'm going to ask for Laura to give introduction, please.
Good morning, Chair Roy and members of the committee, and thank you very much for acknowledging Seniors Month. And I also want to thank the regional chair who took some time out of his very busy schedule on Monday to actually go visit all 4 of our long-term care homes. So that was really appreciated. I'd like to introduce our next speaker. So Cheryl Thorpe is an RN. She is our manager of nursing practice at Hillsdale Terraces. I seconded her for 2 years to lead the work in our development of our emotional model of care. Cheryl is very committed to personal growth and development. This is actually her 2nd career. She started her working career in the world of finance, so she switched over to nursing. And in addition to the work she's doing for us with the emotional model of care, she's actually enrolled part-time at York University, and she's working on her PhD in nursing. And her thesis is studying the underrepresentation of Black nurse leaders in senior leadership positions in the healthcare sector. So very, very timely research that's being done. So Cheryl's presenting on the work to date and the implementation plan for our emotional model of care. So I'll turn things over to Cheryl.
Good morning, everyone. Thank you, Laura, for that lovely introduction. As Laura stated, my name is Cheryl Thorpe, and I am the project lead for the Emotional Model of Care project. And I want to thank you so much for the opportunity just to talk to you a little bit about the project this morning. So for this presentation, I will provide a brief overview of the background. I'll give you some context as well, the circumstances that led to the project's initiation. I will also discuss the significance and the relevance as well of the project within the division and in the broader community. I will also summarize the key findings from relevant literature review that we have completed that inform the project's design and also the approach. I will also provide an overview of the project, including its purpose and the main components. So I want to start off with just some background to this project. So the long-term care sector operates within a highly regulated environment where daily activities and they are structured and they're very task-driven. Historically, the focus has been on a standardized approach to care, often adopting a one-size-fits-all approach. The sector has been centered around compliance with policies, regulations, and procedures, which they're definitely essential, but may sometimes overshadow the personalized aspect of care. We need to shift our focus from the standardized approach to one that considers not only the medical side, but also the emotional needs of our residents. So I know you're all probably wondering, so why are we doing this? So it is really important to look at the results from our satisfaction survey. And from that, we noticed that 83% of our residents and families express satisfaction with the general care and services, indicating a positive overall experience. But only 61% were satisfied with food and meal times, and 49% were satisfied with social life aspect in our homes, but residents highlighted the need to connect with other residents, to share their life stories with staff, to explore new skills and interests, to have their favorite food available, to engage in meaningful activity, particularly on the weekend and during the evenings. 58% of respondents felt that staff members were caring, indicating a strong foundation, but there is still room for improvement. The survey results highlight the significance of empathy, compassion, emphasizing the need to prioritize these qualities in our interactions with residents and their families. So by addressing these growth opportunities, we can enhance the experience, the satisfaction levels of all parties involved. So I want to touch a little bit on the literature review because it's really important, especially when we're doing a new program, to make sure that whatever we're doing, it's based on literature. So a literature review was conducted to gain more insight into the emotional model of care. An emotional model of care emphasizes a home-like environment that fosters social interaction, independence, and a sense of purpose for our residents. Many long-term care homes across the GTA have embraced and implemented an emotional model of care and have reported some significant benefits. Notable implementation includes the City of Toronto CareTO, Peel Region did the Butterfly Model, Chartwell did the Imagine program, Baycrest is currently doing Possibilities, and the Village of Taunton Mills, they have implemented the Eden Alternative. The literature review has revealed 3 common models of care: the Butterfly Model, the Eden Alternative, and the Greenhouse Project. These models share several common elements that are critical for providing high quality care. They all focus on tailoring care to individual specific needs and preferences, placing the person at the center of decision making. Creating a nurturing, meaningful relationship between residents, families, and staff, staff education and training on culture change, empathy, compassion, ensuring that they're equipped to deliver effective care to our residents. Home-like environment and access to the outdoors. Residents are engaged in meaningful and purposeful activities that caters to their needs, their interests, and their abilities. These models advocate for flexibility in daily routines, allowing residents to have a say in their daily schedule and activities. Implementing an emotional model of care has been associated with a wide range of reported benefits for both residents and also for staff, including increase resident activity levels and social activities, improve satisfaction with care and services among residents and their families, improve health outcomes such as there was a decrease in agitation and responsive behaviors, decrease in antipsychotics medication, decrease in falls causing injury and hospital visits, improvement in workplace environment such as improvement in job satisfaction. There was also a decrease in staff absenteeism, and staff had more time to spend with residents because they were spending less time on documentation and following up on incidents. These reported benefits highlight the positive outcomes associated with implementing an emotional model of care, reinforcing the importance of adapting a holistic approach to care. So I know that you're also wondering, so why design our own model of care instead of adapting an established model that's out there? So the literature review has highlighted the importance of moving away from a one-size-fits-all approach to adapting a customized approach that incorporates the best elements from each model. Customizing our approach to care will allow us to better meet the specific needs of the population that we serve in Durham Region. This approach has been successfully implemented by several long-term care facilities, as I mentioned before, the City of Toronto, Chartwell, Baycrest, and this is just to name a few. In customizing our model to care, we're currently looking at the demographics. We're also looking at the cultural background of our residents in Durham Region. We're looking at the level of care required by residents. We're also looking at the available resources and the staffing levels within our homes. We're also assessing the physical and the environmental factors in our homes. In considering these factors, we are committed to creating a care model tailored to the unique needs and the circumstances of our residents in the region. So I just want to talk a little bit about the project itself. So our aim with this project is to create and test a care model that will significantly enhance the social lives and the quality of care and services for our residents by December 31st, 2025. So now let's talk a little bit about some of the expected outcome of this project. We anticipate improvement in resident, family, and staff satisfaction with care and services. Additionally, we aim to see improvement in health and social outcomes for our residents. It is also critical for us to identify the barriers and the facilitators for implementing an emotional model of care divisionally. These outcomes will play a vital role in shaping the future of our care model and help us to make informed decisions. The governance structure of the project includes key individuals who play a critical role in decision-making and project oversight. The steering committee comprised of senior leaders who provide strategic guidance and direction to the project. We have the divisional advisory group, and it's a representation of residents, families, and staff from the different homes within the division, and they offer valuable insight and change ideas. We have the project team at Lakeview Manor, led by Claire Dubla, and she will be responsible for the day-to-day management and execution of the project. Additionally, we have an ad hoc training team that will address the specific training needs of staff as we move the project along. So I also want to talk about the long-term care strategic pillars and the core principles of the project itself. So our long-term care strategic pillars and core principles are the foundation of our commitment to providing exceptional care, creating a positive environment for our residents, families, and for staff. The 8 core principles that will guide this project are relationships, purpose, collaboration, engagement, adaptability, a home-like environment, diversity, equity, and inclusion, and empowerment. These pillars and core principles serve as our compass, guiding us on our journey as we go through this project. I also want to talk a little bit about some of the partnership, because we couldn't do this, or we can't do this on our own. So we are collectively, as we collectively propel this project forward, it is critical to underscore the various partnership and collaborations that are instrumental in driving innovation and progress. We are collaborating with various disciplines within our homes, including nursing, the dietary team, recreation, environmental services. Our partnership include the CAO's office, Megan Fitzgibbon from the innovation team, Daniel Sparks from City Studio, and Lee McEachran from communications, and other staff as well from the diversity equity team. We have also partnered with Ontario Tech University, which will focus on pilot testing. They'll also focus on stakeholder engagement and the research component of this project. So for the project design, we will be following a participatory action approach, emphasizing a bottom-up instead of a top-down approach, encouraging collaboration, inclusiveness, and empowerment from all parties involved. It involves a co-creation of practical, impactful change ideas from our residents, families, and staff. The plan, do, check framework will serve as a guide for our project design, allowing for a continuous improvement approach. We will also be collecting data through doing focus group sessions with our residents, families, and staff. We'll be doing interviews as well, and we will be doing surveys. So I want to give you just a quick overview of the phases in the project. So the project is divided into 4 phases. For phase 1, which is the plan phase, we started that in December of last year, and that goes on till August 2024. And during this phase, the focus has been on the initial groundwork for the project. We have done a lot of engagement with residents and families and staff, and we are now establishing some change ideas, and we're collecting this information again through some focus group sessions that we have had so far. Then phase 2 is the feasibility test, where we will be testing change ideas on one home area at Lakeview Manor. And then we'll move into phase 3, which is from January 2025 to February 2025. And this evaluation phase will provide an opportunity just to assess the feasibility test results. Then the final phase is phase 4 of the project, and it goes from March 2025 to December 2025. And the focus will really be on home-wide implementation of some of these change ideas. And at the end of this phase, we hope to have a final report ready that we can share with all parties involved and also the broader community. So this concludes my presentation. I want to thank you so much for your time. And as we continue on this amazing journey, I also want to thank you for your support as well. And if there are any pressing questions, I need to flip this forward. Oh, my contact information was up there, but it's in the presentation. But if there are any pressing questions, let me know. If
Okay.
not,
So we have Mayor Carter.
Thank you, Madam Chair. Thank you for your presentation. The evaluation and final report, I presume that that'll also have a detailed investment that would be necessary for the region to be able to accomplish this task. Is that correct?
yes.
Okay, thank you. When you were doing your comparison, you compared against private healthcare, I would presume entry level, middle, and higher level private care. How do we compare it to private care?
I would say for private care, based on the research that I looked at, they had more challenges implementing an emotional model of care, just because they have less resources available. The
So I want to step in. Private care has less resources than our system. Is that what you just said?
yes,
So their satisfactory results are lower than ours at 83%? Is that what you're saying?
no. So the 83% that I'm referring to, this is from the satisfaction survey across Durham region.
Right, but
That's
only
we
on
do.
our facilities, not
In our-
private facilities.
Yeah, not in
So
private.
what was the satisfactory results of the private care? Was
I-
it higher or lower?
I don't have that information, but I
Okay.
would definitely get that for you.
On the same slide, on slide 4, there's a mention in regards to satisfactory with food and meal times, social life and all that. Did you do a comparison in regards to what programs private care was providing and the programs that we're providing, and where they see success and where we're not seeing success? Could we take some of their best practices and implement it into our facilities?
Absolutely. So for the food and meal times, some of the homes have implemented flexible breakfast.
Yeah.
So that is something that we're definitely looking. I know we're actually doing some of that at Lakeview. So we're
Okay.
looking at just testing that a little bit more to see how we could make that work for sure.
Beautiful, okay. Just out of curiosity, the cost per resident versus private care versus our care, what's the difference?
I don't have that information available, but
What is-
again, I can
okay.
definitely get that to you.
Okay. What is the comparison in regards to time spent with a resident in private care versus our care? What's the hourly kind of investment?
So that was not a part of the research that was conducted. The research conducted was really looking at some of the change ideas that these organizations were testing, but we did not dig deep into that component. But I will definitely, Laura, I'll definitely make a note of that as well.
Yeah, it's a curiosity because I'd like to know what the difference is.
Sorry, if you.
Yeah, yeah.
In terms of cost per resident day, with the private for-profit homes, they
Yeah.
have to work within the funding of the ministry.
Yeah.
At the region's homes, we subsidize our homes by about 45%. So our costs are probably about 45% higher.
Right.
Part of that is because our salaries are significantly higher than the private.
Okay.
And another reason for that is our hours of care are higher. So they
So I just want to get this. So people that are paying $7,000 to $10,000 privately are getting less care and less resources than our facilities. Is that what you're saying?
the cost to go into long-term care is the same across the province. So it doesn't matter whether you're in private or for-profit homes. So you pay the same amount regardless of what home you are in. But the amount of care that's provided, because we subsidize, the care is higher in our homes.
So that's interesting. So the private facilities that have, private dining rooms and the pools and all that kind of stuff that people have access to they're regulated by the ministry in regards to what it costs?
So long-term care homes are regulated by the province.
Right,
by the
but
ministry.
there are residents that have long-term care facilities within them, correct? In the private sector.
There are retirement homes that have.
Right. Retirement homes that have long-term care that is in those facilities. Is that correct?
In some cases, yes.
Okay.
And-
So did we do a comparison of the services that they have and the services that we have?
No.
We didn't. And did we look at their staffing model and our staffing model? I guess what I'm trying to get to is that I think we do a great job, but I always look at who else is in the market, who else does it better than us, and what can we steal from them.
Mm-hmm.
So that's why I'm asking these questions. Did we look at these private individuals that individuals may be paying $10,000 a month to be able to stay at, to get this long-term care in a facility? Did we look at what they were providing and what we're doing, and is there things that we could copy from them to be able to help us in regards to like the food and meal times? That to me seems like a low-hanging fruit. That may be, traditional foods may not be appropriate. Maybe because of the diversity of our community now, that may come into play, and maybe the private facilities are providing that. So that's why I'm asking these
Yeah,
questions.
I think you just have to be careful that the retirement homes are regulated under a totally different regulation than long-term care homes. So they're
Right.
private long-term care homes,
Right.
like the extended cares, the Chartwells, the Rivieras, those types of things. And then there's retirement homes, but they're totally different in
Right.
terms of regulations. So the
Right.
population is different and the level
Right.
of care is different.
So maybe I'm confused because I'm aware of a Catholic long-term care facility in Toronto that has both retirement home and long-term care.
Yeah.
I know what they pay, which is about $10,000 a month, and so
They would.
that's where I'm getting confused.
Yeah.
So that do they fall under two different categories
Yeah,
then?
if they're paying $10,000 a month, they're living in the retirement section. If they're paying the provincial rate, which is, I don't know off the top of my head, about $1,800 a month, they're in long-term care. So they can be in the same building, but they're totally different regulations. They're totally different
So that's
types of
significant.
clients.
That's
Yeah.
significant. If our budget on per person is $1,800 and private care is $10,000,
But
there's going to
private-
be huge. There's going to be huge gaps in regards to what you're able to do, in regards to personalized service, hours of care, types of meals, facilities, and what they offer, all that kind of stuff, right?
We just have to remember that private care retirement homes are different than private care long-term care homes.
But there are facilities that what I'm saying is there are facilities that
Yes.
have both.
Yes.
So I'm just trying to understand. If we could do it, it's almost like in an airplane, right? We could have great service in first class, but the rest of the tube also can get great service, right? So that's what I'm trying to get to. Okay, so that helps me better understand the differences of the two. So, but we are doing comparison in regards to those that are in the private sector and what they do best and what we can learn from them so that we can implement it. I'm presuming. Good. Thank
Mayor
you very
Carter,
much.
the commissioner,
Thank you.
Mayor Carter, the commissioner has comments too.
Thank you. Yes, I just wanted to add, for the purposes of this project, the comparisons that we're making, we're looking at the homes that actually have an emotional model of care program. And those are the ones that we're taking a good look at. We're not looking at everything in all of the long-term care homes. We're looking specifically for the emotional model of care, Mayor Carter. Okay.
Thank you. Any additional questions? I'm not seeing any. Thank you very much for the presentation today and for the work. I'm glad that you stayed on.
Thank you. Thank you so much again for your time and attention. Thanks.
Great, thank you. Next, in 5.3, I'm going to call upon Marusha Lashuk, Director of Family Services, to give introduction to the next presentation. Marusha?
Oops, there we go. Good morning, Chair Roy and members of committee. Thank you for this opportunity to have staff present at today's committee. I have the pleasure of introducing Sharon Woods and Morgan Denby in recognition of Seniors Month and Elder Abuse Awareness Day on June 15th, which acknowledges the significance of elder abuse as a public health and human rights issue. Sharon is the Senior Safety Advisor in the Social Services Department within Family Services. She is a highly experienced social worker and mental health clinician with over 30 years' experience in supporting individuals and families living in Durham. In her role as the Senior Safety Advisor, Sharon is passionate about supporting older adults to be safe and secure while helping to promote wellness and social connection and education in the community. Morgan is the Community Support Specialist in the Social Services Long-Term Care and Services for Seniors Division. Morgan has been supporting older adults and their families to secure services and the supports they need to remain in their home and as full participants in their community. And Morgan has recently been accepted into a Master's of Social Work program, and she hopes to continue the important work that she does supporting residents in our community. So I'll pass it on to Sharon and Morgan.
Hello and good morning. Thank you so much for making space for us to have this in conversation in regards to our older adults in the community. I am the Senior Safety Advisor for the region of Durham, and I am very excited about this particular program. Right now, we are looking at the number of seniors within the region of Durham, and my role and purpose as a Senior Safety Advisor is to partner with Social Services Department and Durham Regional Police, most specifically the Older Adult Support Investigative Services. There was a section that I was going to talk about in regards to this picture, and the chair, you had so well expressed this, the highlighting of our seniors. This is the senior, this is the month for us to celebrate and acknowledge the seniors in our community. These are older adults that has really contributed a lot of their time and efforts into making what we see available for us today. And this is something that we are most grateful for. Each of us know an older adult in our lives, whether it is a family member, whether it is a friend, whether it's a coworker or a neighbor. Many times we have seniors that are in need of our support, and I'm really glad to know that my purpose is to support the lives of these older adults in our community and to ensure that their safety and well-being are being met. Many of the things that I do are promoting awareness and safety issues affecting older adults in the community. I advocate on behalf of older adults, their rights and their needs. I respond to inquiries within the community as well, offer assistance, direction, and support on safety-related matters. And I'll speak a little bit more and show you the various community partners that I do communicate quite often with to see how we could support or better provide services for our older adults. If you could just take a look at the number of calls that we have been receiving, I will talk more about that. But right now, we have 20% of our calls that come in from the clients within the community, and these are older adults. It could be a family member. 18% are community agencies as well. The family members are 14%, and 14% of those family members are not necessarily people who reside in the region of Durham. Ironically enough, I've had calls that came in from BC. I've had calls that came in from Alberta and the United States. These are family members that are calling into the region of Durham, asking questions about services that we offer, about power of attorney, care for their loved ones in the hospital, conversations that they may have had, or a call from a neighbor that they received, and they're concerned because this neighbor is not being treated well. It is very concerning. I get also calls from home and community care. Public inquiries, it does say 10%, and this is really 10% within the last 3 months or so. This is not 10% for the full year. Lakeridge Health, we do communicate with them quite often enough when they see any problems or concerns in front of them. And they would call, whether it's inquiries or call because they see a particular need and is asking for support. Support in the way of what can we do to support this particular person that is lying in the bed or has been brought in through emergency. Support because they witness a family member that they have some suspicions about and want to get some directions as to what steps should they take to support this individual. Agencies that I do interact with a lot, as I said before, is home and community care. Also Durham Regional Police, and more specifically the OASIS team. The OASIS team do call me by making referrals. If a police officer will call in and will express some concerns when they were out on a call, that number is increasing drastically. And they have expressed quite often, you know, the sense of helplessness, not only what they see, but how they feel, because they're not sure what directions to take. We have a variety of agencies that are filled to capacity, and they may not be able to take someone in right away, and we need some type of way to support them. And it might be emergency housing. It might be connecting them to a family member in the community. It might be finding out who is the person who's the power of attorney for this particular individual. And as I said, Lakeridge Health, but also long-term care homes will call as well, just to express concerns, but also to talk about some challenges that they might be facing. And together, we would try to figure what is the best way to deal with this particular situation. Sometimes they may not reveal the person's name because they have not received consent at this time. But, you know, it's good to know that we can troubleshoot and we can find out really what alternatives are out there. And this is something that has to be done in a timely fashion. Women's shelter, you know, there's often times that I am called by, whether it's home and community care or often by Durham Regional Police, because they need a shelter for a particular person. This is something that is time sensitive, and so we do need to often act quickly when we do this. But it's not always the most easiest thing to do because many of our shelters are filled. Also, if this is a male and he needs shelter right away, we have only Cornerstone to really send them to, and that may not also be appropriate for an older adult to go to. Some of the presenting issue, as you see in front of you, you might look at the yellow graph and say, 40%, where is that coming from? These are all the issues of abuse. We've tabulated them all up, whether it's undisclosed type of abuse, someone may call in and not definitely express what type of abuse they're experiencing. Sometimes people don't know how to define what that abuse is, but they know something isn't feeling well, and they know they need to get away from what is happening to them. There's a lot of neglect, verbal abuse, emotional abuse, and financial abuse. Housing is the biggest component of concerns that we have. And as I've expressed, whether it's emergency housing or someone who is being evicted, imagine an older adult being evicted from their unit or being told by a family member that you're no longer needed here. That's really hard to stomach for anyone, but more so for an older adult that do not have the same type of connection they may have had in the community 20 years ago or 15 years ago. And so they may not know to call me, but they might reach out to the paramedics, for example, because that's who they've been calling most frequently for help. The other piece is in regards to stress. It may seem like 8%, and I know that may seem like a low number, but think about all that is happening that I've shared so far. These are stressful situations for an older adult. So they may express like, I'm really feeling stressed because of financial abuse, because of the lack of food insecurity, because I'm not sure where to go, I have to leave where I am, because my rent has increased and I cannot afford this. In 2023 alone, the number of interactions we had was 1,106. In 2023, just for the first quarter between January and March, there was 247 interaction. In 2024, when we make that comparison, it has increased to 452 interaction just in the first quarter alone. That's 205 number of callers, and that's an amazing increase right there. Aside from engaging with individuals directly, the indirect support is workshops and presentations. And as you see, the numbers indicated, just in 2024, there was, for the first quarter, 11. But it was really nice to see John Henry when you were out yesterday with the LEAPS program. And I was also invited as well last week for MPP Barnes luncheon, and to see the amount of people that are sharing and speaking out loud about their interests, concerns, and their passion for our older adults. This is something that I feel is very important, not just personally, but if you look around, there's quite a number of retirement homes and nursing homes that are just being built in Durham Regional alone. It's being filled. And some already have a waiting list. Can you imagine? So Durham Region is the fastest growing number, or has the fastest growing number of older adults within the region of Durham, and it's not slowing down. So I hope this presentation alone just highlights the importance and significance. I wanted to share with you that there is only one senior safety advisor for the region of Durham, and I do have the benefit and the privilege to have Morgan Dunby, which you will she'll speak with you soon, who does assist. And we are extremely busy out there on a regular basis. We are learning, we are growing, we're trying to keep up with the calls. And just to give you a scenario of an individual that we had an engagement with, Durham Regional Police had called and expressed some concerns. They went out on a call. It was a neighbor. And I'm really excited to just say, like, you know, we need to give gratitude to our neighbors. When they see things, they are calling out. People are not just staying silent. And this neighbor called the police and said, I'm really concerned. There is this older adult, and she's been walking around. I've been feeding her periodically, and I don't know what's going on in that home. And she was being held in a home with a number of other individuals. And this person said, I will take care of you. I will take care of all your needs. This person had gained access to her banking account and had not allowed her to have a phone, not allowed her to have the food or meals that she wanted when she felt like it, because she didn't have access to money. She didn't have access to care. She did not have home and community care coming to her to support her, as she's a diabetic as well. And so when they reached out to me, I reached out to one of the shelters. They did accept her. Shelter's capacity increases on a daily basis, and sadly, this person has been in the shelter for the last 9 months. Women's shelters are often keep individuals there for 3 months, and she's there for 9 months because there's nowhere else for her to go. We did have the benefit of, you know, getting her some clothing, to something to keep her warm, a hat, some food while she was there at the station. Everyone is really doing their best to support individuals, but we need more. I hope, as we recognize and acknowledge this month as seniors, and we acknowledge the amount of work that they have done, that we could do something for them in return. And I also invite each of you. Family Services has a table downstairs, and we have a number of brochures and pamphlets, but also agencies that are coming in on different days, just to highlight the type of services that they provide and ways that people can connect with them. Thank you for your time.
Thank you. And is Morgan up next?
Morning, my name is Morgan Denby. I am the Community Support Specialist in the Long-Term Care Division. I'm here to tell you a bit about the wonderful work I do in support and partnership with Sharon, the Senior Safety Advisor. There we go. So my role has a few key aspects, one of which is to partner with, like mentioned, Sharon, the Senior Safety Advisor, and support older adults navigating elder abuse or a safety matter. I will go over this in a moment. I also manage the intake application and eligibility of the Homemakers program. My role also focuses on community engagement and education to both community members as well as to internal and external staff, and partnership development. I'd also like to highlight the wonderful resource guide that was recently published this year in community in support through a seniors community grant. We created this guide in collaboration with our Diversity, Equity, and Inclusion Division, as well as the Community Safety and Wellbeing team and the Social Services Department. Overall, my role and portfolio includes supporting older adults, families, service providers, and community partners with connection to resources and supporting them with service navigation. I just want to highlight a couple of additional points to the example that Sharon spoke about earlier and highlight the wonderful collaborations that we have with our community partners. Currently, we continue to have ongoing follow-up with this individual in community, in collaboration with Home and Community Care, our shelter system. Sharon and I continue to complete community visits to ensure that this individual is receiving the supports and the accurate services they require as their mental health, their cognition, and their housing needs change. I'd also like to mention a few outcomes and next steps for this individual. So this person does remain safely housed and connected to appropriate supports. And we hope once this person receives access to permanent housing, we will likely be making further connections to ensure this individual has an increase to social connections, improve their quality of life, and remain living safely in community. Next, I'd like to go over the Homemakers program. A bit of background about the program. Originally, this program was managed through the Income Employment Homelessness Supports Division and moved to the Management of Long-Term Care in 2017. Since then, the program has grown the caseload of clients served and increased the funding to support the continuous increase in need. A little bit about what the program is. The program provides subsidy for homemaking services to Durham residents who are eligible for services. It provides short-term support for light housekeeping and laundry support. Approved services are dependent on the assessment of the need, and to clarify, this does not include personal care services. We heavily rely on home and community care to provide that. The main goals of the program include to assist with household tasks, provide comfort and support in the home to both adults and older adults residing in community, and to support those living independently. This program also acts as a preventative approach to reduce housing challenges escalating to eviction or homelessness. To be eligible for the program, you need to have a verified need for service, including a medical condition. It could be you're recovering from a surgery, you have a diagnosed developmental disability, or you're experiencing a physical or mental health challenge. You also need to financially qualify, which means you need to meet the low income threshold, which is having an annual income under $27,000, and meet the asset levels. In terms of assessment, we assess clients during both the application stage and every 6 months to ensure that their service plans continue to meet their needs and their requirements. In terms of funding, we are the smallest program provincially, and we are a very small funded program, mostly through the Ministry of Health, and we are currently working on expanding the funding to expand supports to support our need. Normally, I'd hand off the mic to my colleague, Michelle Van Etchkin, but I'm going to speak on her behalf on the Adult Day programs. So the main goals of the Adult Day programs include to assist clients in achieving and maintaining their maximum level of functioning within the community, to create individual care plans, to provide supervised social and recreational group programming to adults over the age of 18 with Alzheimer's and related dementia, to provide a hot meal and nutritional breaks, as well as to provide respite and support to our caregivers. I'd also like to mention that referrals are sent through home and community care and assessed there as well. We do have 3 main sites. So one is at Hillsdale Estates, one is at Lakeview Manor, and the other is at the Port Perry Hospital, all functioning. So for example, Hillsdale Estates functions 5 days a week, Beaverton is 3 days, and Port Perry is 2 days. The numbers in terms of accommodation vary. For Hillsdale Estates, they operate under the category of specialized cognitive programming. All programs serve a very diverse and multicultural communities, and we ensure that all aspects of the program are mindful and inclusive of all those needs. Staff and volunteers are specially trained in dementia care and therapeutic recreation practices, including You First, PIECES, gentle persuasive approaches, Montessori methods, and responsive behaviors. I'm just going to highlight an example of someone in a community that is accessing this Adult Day program currently. So we have an individual with moderate to severe Alzheimer's disease and requires 24-hour care who cannot leave their home and is residing in community currently. There's a lot of things that this individual is unable to do, including their daily ADLs. without guidance or supervision. This individual attends our ADP 3 times per week, and she lives with her older adult daughter in community who is also experiencing many challenges. The daughter has 2 children, and she also works heavy hours to support both the financial need of the senior, the elderly mother, as well as their children. So we can say that this individual who is part of that sandwich generation is being pulled in many directions. What we'd like to make note of is, due to the senior attending our adult day program 3 times per week, both the daughter and the mother are able to still live a quality of life, and the daughter is able to receive respite support, so she's able to take care of herself and all the family members under her home. Thank you so much for your time, and is there any questions for Sharon or I?
Thank you very much, Morgan. Is there any questions? Hearing none and seeing none, thank you very much. I'm now going to call upon Lisa McIntosh to give introduction for our final presentation. Lisa? This is 5.4.
Good morning, everyone.
Good morning.
So this morning I'm introducing Sahar Forwatani. Sahar is she is the manager responsible for homelessness system management work in the Income and Employment and Homelessness Supports Division. Sahar jumped into this role moving quickly last April, so April 2023, and has been working to establish a strong system with strong practices and to support positive impacts across the region. Today, Sahar will provide the quarterly update to share work that has been accomplished so far and some of what is to come to meet the requirements set out in the Integrated Homelessness System Action Plan presented to you in January of this year. Work to support people at risk of becoming homeless and those who are homeless is complex work. It requires innovative, complex solutions, and although we are moving really fast all of the time, it also requires additional time and patience to be able to move things forward. We are working to increase individual and community well-being, and as the system manager, we acknowledge that we do not do this work alone. So at this time, I'd really like to take the opportunity to thank this committee and council, as well as my regional colleagues in health, DRPS, works, finance, corporate communication, just to name a few, as well as the teams that we work with at the local municipalities, service providers, and community partners. We work closely with so many organizations to help us move forward and strengthen our system. So I'm going to turn it over to Sahar to share the updates that she has for this quarter. And just again, thank you to all of you who are supporting the work that's happening in the community.
Thank you, Lisa.
Good morning, Madam Chair and committee members. As Lisa mentioned, my name is Sahar Fortani, and I'm here to provide an update on the Integrated Homelessness Action Plan. As mentioned, this was shared with the committee in January. The homelessness system has been working towards implementing action items outlined. I'm just going to get this. Here we go. Outlined in our report related to the 5 recommended strategic goals. Goal number 1, implement system integration, planning, and management. Our system has been conducting over 17 information sessions and presentations on the regional street outreach team with available tools and establishing partnerships. We have presented and delivered to various community partners, including the library, post-secondary, as well as the municipal bylaw. Goal number 2, improving system capacity and service levels. we have implemented a coordinated access approach for our winter warming services over the 23-24 period, where the unsheltered population had access to the shelters that were available across the region. This included prioritizing transportation and maintaining a consistent communication to ensure we knew where available space was. Goal number 3, expanding social and community investment. We have facilitated quarterly meetings with our local area municipal bylaw teams to discuss best practices and improve approaches towards addressing homelessness and encampments in the communities. Goal number 4, achieve system excellence. We continue to have monthly meetings with the Community Liaison Committee to discuss strengthening partnerships between the community and our shelter patrons at 1635 Dundas. Goal number 5, boosting system growth and housing supplies. In 2023, 238 individuals moved out of the homelessness system into housing. Our goal is to support the growth of regions' housing supply by providing ongoing data and information on the homelessness system. This is a quick snapshot of what our data presented in 2023. As you can see, the average number of individuals on our by name list experiencing homeless continue to grow. The first half of 2023, the numbers were pretty steady. However, it started to quickly move and increase as the year went by. We saw a slight dip in May, which oftentimes could just be with a warmer weather as well as winter warming closing. By December 2023, 451 individuals were recorded as experiencing homelessness according to our by name list. However, it's also important to note that 238 individuals were successfully housed within the system. These individuals also included 120 of which were considered chronically homeless. And just to quickly touch on what chronically homeless means, it's defined as an individual or family who is currently homeless and has been homeless for a total of 6 months over the past year, or reoccurring experiencing of their homelessness over the past 3 years. In the first quarter of 2024, we have seen at least a 50% increase in individuals experiencing homelessness within the by name list. This has brought us up to 604 as of April. This could be a result of adding additional access points through our outreach workers, as well as removing the 14-day requirement of individuals being identified as homeless. The system continues to work towards capturing better data that helps reflect the communities. The demographic for 2023 is as shown in the slide. We have 37% of individuals identify as female, 61 identify as male, 1% identify as transgender, other, or unknown. When we look at the age range, we had 15% that were considered youth, that's 24 and under, 75% that identified as adults, that is 25 to 59, and 10% that have identified as seniors, that is 60 and over. And as Sharon had mentioned, these individuals in her presentation, that 25% of these seniors are looking at housing being an issue for them. And although the 10% may seem a little bit low, it's a significant increase over the years of what we have seen. When we look at the Indigenous status, we've got 5% that identify as First Nation, 0.2% identify as Inuit, 1% as Métis, and 4% have identified as non-status. And when we look at household types, we've got 85% identifying as singles and 13% identifying as families. Based on the data, we know that our homeless population consists of single males between the average of 25 and 59, with a growth in seniors and families. The shelter system over the past year, we can look at the fact that it's been at capacity. So it was spoken to in the previous presentation as well. We have been at capacity for over 2 years. We only had 145 beds in our system last year, and we had to access 316 admissions and stays through our hotel program. And those are to support families, seniors, and those with special accommodations. 633 individuals were turned away due to unavailable beds. That's a huge number when we look at it. So 622 of those individuals. And once they are denied access into the shelter because of lack of space, they're always referred to appropriate services with whatever that may be available at that time. As well, we have recorded 43 individuals who have successfully been diverted back into appropriate accommodations, which could be through family, through friends as well. I'd like to shift the focus a little bit and talk a little bit about the winter warming over this past year. Just so that we are aware, winter warming is a temporary space that provides a warm place for an individual experiencing homelessness to seek protection during the cold weathers. Winter warming typically runs between November and March, where temperatures drop to dangerously levels. These services can include a warm space for individuals to stay overnight, essential items such as hot meals, snacks, beverages, blankets, warm clothing, a change of clothing, access to washrooms and sometimes showers, and information's referral to services, mental health, addiction supports, and other community resources. This is the statistics for what this season looked like. So we were able to add an additional 100 spaces to support the homeless population through the months of November to March. Duo, which is the overnight drop-in center, also continued to keep its doors open, which offered an additional 50 spaces each night. As well, our shelters and winter warming would accommodate with any additional mats and seating once the temperatures dropped extremely low. As you can see, we had 819 individuals access winter warming over the past season. This is space and individuals that came that typically would not have accessed our spaces. Some of our highlights over the year and what we learned were 150 spaces were provided and 7 days a week shelter was available for individuals to come and access. And some of these spaces also included medical needs. This was my favorite part, pets were welcomed. This is something that a lot of our individuals that are facing homelessness struggle because a lot of our shelters or a lot of our spaces don't allow pets. So we welcome them with open arms. Cots and chairs for individuals and couples. This was kind of noted in the debrief that we had. Because we see a significant number in couples and families, like I had mentioned, couples like the fact that they could have their chair or their cot next to their spouse and their partners. We also looked at accommodating oversized cots for individuals that needed that additional accommodation. We increased our access points for more individuals to be added to the by name list. Individuals who typically were not able to access these supports were using winter warming and were allowed to have the connections to the homelessness system and offer the supports that are being provided. The coordinated access between the agencies helped to streamline and avoid lineups outside of winter warming, which we had seen in the past. We created and established a number of partnerships with local businesses through donations, meals, snacks, care packages, as well as the coordinated access between our outreach team and the winter warming centers really allowed for the outreach team to be able to transport individuals to different locations, which helped those accessing it have additional support, establish connection, and build rapport with our outreach team. And it's also important to highlight that we didn't want to leave anyone behind. So if anyone called, we were able to transport them, but making sure that they had the available resources available for them to get back to their communities the next day. Some of the challenges that we came across. Transportation was probably number one. North Durham, as we know, has a lot of challenges when it comes to transportation. Also accessibility challenges. One thing that we discovered was there's no accessible Uber or taxis after 11 p.m. each night. We facilitated the motel program for our individuals in the north, and what we also learned is that motels are not best options. They lack the wraparound care that is needed that some of our facilities are provided. Now, also there's food situations that happen in with motels. There was also staffing challenges that we saw from an agency's perspective, so staffing calling in sick, high turnover rates, and then how were those winter warming centers being staffed. We're looking at improving our coordinations with Durham Region Police as well as local hospitals, so avoiding dropping of individuals who are intoxicated or heightened, as well as individuals being discharged with no housing or aftercare supports, which would create additional concerns on site. Locations with washrooms and access to shower. That was probably key. We were fortunate enough that washrooms were available, but definitely we had challenges with showers. Lessons learned. So our lessons learned and what we will be taking into consideration as we plan for 24-25 season is making sure that accessible space with showers and bathrooms are available within each community. Staying open 7 days a week, regardless of the temperature. So I think moving forward, we're going to try to avoid based on weather, because when you are wet and you are cold and you've been on the street for a number of days, a degree or two does not make a difference. So we're looking at making sure that our shelter or our winter warming centers stay open 7 days a week. Winter warming being offered in our all lower tier municipalities, so that's including the north, so hopefully having space available in Uxbridge, Scugog, and Brock as well. Increased access to transportation between winter warming. We'd like to create more partnerships and establish connections there, as well as offering more daytime programming in the Durham communities as well. Shift our focus a little bit to give you a little bit of an update with our 1635 shelter. So admissions, we opened on March 20th, 2024, and since March 25th, the shelter has been at capacity with the 45 beds. Many of the shelter patrons transitioned from winter warming center to the shelter. So this was actually great timing, because as we were closing our winter warming here at headquarters, we were able to transition individuals to the shelter, which really helped. As of May 27th, 117 unique clients have had stay, as well as 2,935 bed stays. As of May 15th, 1 has transitioned to a treatment program, 1 transitioned to housing independently, 1 has transitioned to supportive living, and 3 have moved back with their families and their friends. Some of the programmings and services that are being offered are ongoing social events and activities. So they've got game nights, karaoke, movie night, hockey night, lots of art programming. As you could see, those are some of the artwork that was completed by individuals at the shelter, as well displayed. Just recently, there was a community garden, We Grow Food project, which happened over the past weekend, and I see a couple of nods. We had a lot of individuals there as well. Lake Ridge Health Pinewood on site to provide mental health and addiction support services. Collaboration with John Howard Society of Durham, providing on-site harm reduction support services, housing and employment assistance. Durham Community Healthcare, providing medical support, including hepatitis C screening, testing, and treatments, as well as the mobile health team is expected to be on site, I believe, starting this month. As well as some of our upcoming programs are going to be on-site workshops, managing emotions, wellness journey, and it'll be our very first 8-week Getting Ahead series that will be starting in the fall as well. We are looking at doing cognitive behavior therapy as well, so this is to start this summer, and a running club as well. And here's some stats regarding our Durham Region Street Outreach team. So we have had 4,516 total interactions within Durham Region. This is as of January 4th until May 26th. 688 group interactions where there was 3,129 individuals present, as well as 3,389 individual engagements with 137 encampments, which 280 individuals were identified. There was 302 public and business interactions, more than 85 interactions with Lake Ridge Hospital, as well as over 32 interactions with Durham Region Transit. And that concludes my presentation. Thank you, and open to any questions if there are.
Thank you so much. Mayor Carter.
Thank you, Madam Chair. Thank you for your presentation. First, I want to start off with a very positive note, which is 1635 Dundas. I think you guys have done an incredible job. The amount of programs you're bringing in, the partnerships you're bringing in, the kind of scope, I think has been tremendous. And I got to be absolutely honest with you, I'm around 1635 on a weekly basis. I see how well it's running, and great job, like unbelievable job. And I think it's a model that we can transfer into other communities. So I want to start off by saying tremendous job. Winter warming lessons learned. I see your points here. I think another point you should take into consideration, just for your own data, is the impact on local communities. I think it's important to be able to have that dialogue with local communities. I can share with you, with one of your locations, Duo, we had over 2,500 interactions and close to $300,000 of an impact in that particular community, not including bylaw, security, fire, and policing. And just to let you know, Madam Chair, we have over 30,000 data points that we've collected over 12 months. So this isn't half information. We've got a lot of information that we're doing, and I think that should be taken into consideration. So I'm asking you if you would take that into consideration, please. On your winter warming challenges, in regards to your staff, what is the ratio of staff versus visitors?
I know on site here we had 15, so it'd be 15 to 1.
15 to 1. How about your other agencies that are participating, such as Duo or anywhere else?
Similar. Each location would offer different space amounts, so we had anywhere from 10 to 22. Also keep in mind that we had security on site as well, which we're able to support.
You had security where?
We had security on site here as
Oh,
well.
here, okay.
And
All right.
correct, other winter
Okay.
warming centers
I
as
don't.
well.
I don't believe you had security at Duo.
We did.
I know we had security at Duo, but you had 24-hour security at Duo. Is that what you're saying? I want to get a clarification. Was there security at Duo 24 hours a day when you're providing the winter warming program?
Winter warming isn't open 24 hours at the Simcoe location
Okay.
with the chairs, but they have security on site.
On site.
When they
It's-
are open, yes.
When they're open. Okay, so that's good to know because our data shows that that's not the case. So we will have to get a clarification on that. Your winter warming centers, when is the program coming forward for 2024-25?
We've had the original debrief in April, and we are hoping to start this summer. So by the end of the month, I'll have my initial meeting with individuals that will going to be taking part, and we're hoping to start in November.
So these agencies that you're speaking of, is that what you're saying?
It would be agencies that would be taking part to have oversight at the centers.
Okay, and how are you sharing what agencies have been selected to be part of this winter warming program?
We've had agencies that have supported over the past year, so we lean into them, as well as if there's any other interest that would like to support.
And so the local communities are engaged throughout that process? You're not just selecting them individually, the communities and cities are also either approving or not supporting those agencies that you've selected?
So we are limited to the agencies that do this work in the region,
Yeah.
but we work closely with all of the local municipalities and
Right.
do walk-arounds in the communities, come to community meetings, plan these things out very carefully. There is fallout at times from homelessness programs. We are quick to address those and work through them. So numerous meetings are occurring. We've already started having planning sessions and meetings with some of the local municipalities and at community sessions. I think Sahar and I were out a number of nights last week across local municipalities in Durham.
Okay, so I'm going to go back to my original question. Local communities are at the table as you're selecting these agencies to be able to provide warming centers, and this local communities are also giving either their approval or disapproval in regards to it.
It's within our system work, so they are giving us feedback, not usually about the agencies. We haven't necessarily had negative feedback on individual agencies. The staff in our system work very hard and they do the work that is required. Location conversations where there is space, there's a limited amount of space and we have to work with individual local bylaw and fire to ensure things are safe.
I get that. I
just wanted to add-
I understand that. Oshawa made it quite clear, specifically, about an agency that you had selected last year, that it was not supported because of the reason that it wasn't staffed, in our opinion, appropriately. It wasn't in the appropriate location, and the appropriate supports were not in place. I know that myself and Councillor Chapman made that quite clear, and I'm sure our CAO and our commissioner made that quite clear. But the region went ahead and implemented that agency to be able to have a warming center. So I'd like to know, are local communities going to have the opportunity to be able to either support or deny warming centers?
Mayor Carter, I'm going to turn it over to the commissioner.
Thank you for that question. We did speak earlier, Mayor Carter, and we will be taking your advice and have a meeting with you to talk about this particular local agency. We did meet, staff did meet with your staff, and decisions were made accordingly, especially because there wasn't another option, and we were getting close to the end and winter was starting. So there was a need to really move quickly. We will have a conversation again with your staff this year. We're looking to have a meeting with them. I believe they've already met. However, we will continue that dialogue, and we will include you in that conversation as well.
I don't know how much more clear I can make it. And I think our staff have made it quite clear. And I'm facing a deficit in my budget based upon decisions you're making. And when we've asked for specific aspects in regards to making sure that we have the right people doing the right things at the right locations, we've been ignored. And I don't think that that's fair, because we made it quite clear that the agency that you had selected, we did not support.
That's not true, I know.
Several times.
So going into the winter warming season of last year, we met with Oshawa staff and the agency service provider. We looked at alternative space, and the service provider direction we moved forward with was after and through those consultations. It was not a definite, and there was no direction given that there were other options, or that this was a service provider that we weren't going to move forward for. I have heard
So-
your concerns and looked at the
Yeah.
data, but we did have those meetings and we definitely did our due diligence.
On
So-
this
so
one,
the-
Mayor Carter, I think that it might be best that on this one situation that we sidebar this and take it aside and have a thorough
Well,
conversation,
Ma-
especially
Madam-
around, I'm
Madam
not,
Chair, I agree, but I'm going to put it on the record right now.
I appreciate that.
That both Councillor Chapman and myself and our staff made it quite clear in regards to what the requirements of warming centers and what we expected in regards to supports. This agency, we said we did not support because of the reason that we didn't believe that it had the components. Our data shows that that is exactly what happened.
Okay,
So I want that on the record.
no, and I
because-
appreciate that it's
Because
on the
what I'm
record.
hearing is it wasn't on the record. So I'm making it on the record
Okay.
now.
So we will take this aside because I think this is a individual conversation, a lengthy conversation, and have all parties sitting around the table to resolve this.
I agree, but you know, you've done a tremendous job with 1635, making sure all of the elements are put in place to be able to have a success.
Yeah, and
Right?
that's also taken the efforts of not necessarily here. It's
Right.
been making the request of bringing everybody around the table to
Right.
be a part of that success. And every single day, we're
Right.
still working on that.
Right.
Like even as of bringing the Durham Regional Police together, bylaw together, we're working on our encampment strategy. We're ensuring that as we're transitioning and changing, even within this year, as we're seeing our community change as well too, we're transitioning every week. But it's roundtable conversations that are sidebar.
And I think that's wonderful.
Yeah,
But I know for a fact that we're not having roundtable discussions in regards to the winter warming program that we had previously because our concerns were ignored.
Okay, I'm going to
So-
commit to you
so
right
that's-
now.
I
We will
appreciate it.
arrange to have that roundtable conversation, and I would like to be a part of it. Because if we can take some of the model of what we are discussing, especially at 1635, let's see what we can introduce together.
Thank you. 622 individuals were turned away in regards to warming shelters. Just out of curiosity, it says that our shelters have been over capacity for 2 years. What are the other municipalities? Where are they when it comes to capacity limits? Toronto, Peterborough, Lindsay, Cobourg, Port Hope, Mississauga, Brampton, Brantford, London, Guelph, Hamilton?
So
Are they over capacity?
shelter capacity is an issue in many communities.
Yeah.
When we look at per capita, how many beds we have in our system, Durham's population is growing fast, and for community our size, with 1635, we have 190 beds in our system.
Okay.
We have limited access. The number of people on the by name list far exceeds the number of beds I have in the system.
Okay. So how do we compare against those other communities that that we're benchmarking against?
We can pull the data on turnaways and some of the comparable data and share it with you. So we will get that for you and send it out.
The 622 turnaways that you had, that's 1.7 persons per day. That's what we're, so are we saying that we're 2 beds short?
No.
Okay.
So currently I can share that we are piloting a wait list
Yeah.
at the 1635 location. And we know that there are about 130 people who are waiting to get in.
Okay. And that includes November, December, January, February, and March? In the winter time?
We only opened 1635 mid-March.
Right. But the numbers that you're trying to work on, do they also account for the winter season in regards to beds that are short?
Winter season gave us the warming spaces, so the data would be a little skewed on turnaways. Sahar was able to work across communities and significantly increase the number of beds that we had available and chairs that we had available. So Pickering had a site that was open and offering supports, and there was winter warming right across the system. So that brings people indoors and changes the access and requirements for turnaways.
Do we have any idea where people go in the winter season? Our numbers drop dramatically. Do we have any idea where they go to?
Our
I
numbers,
mean, even our encampments are a lot lower across the region in the wintertime. So where, if they're not at the warming station and they're not in our beds, where are they?
our warming center spaces that were opened last winter were full.
Yeah. and that's-
In
and how many-
addition,
that was
shelters
100
are opening those mat spaces and
Yeah.
additional chairs, so they don't breach fire code.
Yeah.
But they use every available
Right.
space to keep people indoors, because we
Right.
know being damp is life-ending for
Right, so
those
that-
who are outdoors.
So that's 100 spaces, okay. But I'm just wondering, from your expertise, where do they go in the winter?
We have encampments and we are following people outdoors in the winter.
I understand that. Encampments through the winter season are lower. Where are those people going if they're not in the warming stations?
They could potentially couch surf, but we really are seeing people who have been outdoors for years coming in and using warming. And with the introduction of the outreach team this winter, many of the individuals who work in the system, and many of you from the work you do in communities, those people that you know who have been outdoors for long periods of time, we saw success with getting people to come indoors and giving
Okay.
them individualized space or chairs where we could.
Okay. Last question is your expanded social and community investment. This is on, I think, slide 3. When is that report coming up, and will that report be shared with council and communities?
So continuing to look at investment in this system is coming from multiple levels. Those are the asks that we are sending forward in requests for letters and your motions to other levels of government. This can't just be an ask for the regional council. It will be, as well, our asks will be included in our regional budget submissions that go forward. But it is a multi-phased process. We are looking at every avenue of grant and access to funding that we can find across the system.
Sorry, maybe I misspoke here. It's item 3, expanding social and community investment. Facilitate quarterly meetings with local area municipalities, bylaw teams to discuss best practices, improve approaches towards addressing homelessness and encampments in the community. my question was, when is a report with this information coming forward for council or this committee?
So we are currently meeting with bylaw teams and individual and local municipal staff on a quarterly basis. Those meetings are occurring. I can request and we can share minutes if you would like from those meetings. We have been bolstering those meetings, looking at and developing new strategies and processes within the system, and one of those being the meetings that many councillors and committee members, as well as local municipal teams, have been attending related to building an encampment strategy for Durham.
Okay, so there is not a report coming forward for this committee or council?
There's not a specified report coming forward.
Thank you. Thank you, Madam Chair.
Mayor Carter, would you like an update brought to this committee?
I think it's important that this committee has that information. It's done on a
We will-
quarterly basis.
Yeah, we will,
And I think it would be good.
yeah, we will coordinate that
Thank
on a
you.
quarterly basis.
Thank you.
Yep. Further questions? So I'm not hearing any, but I do have a couple of questions. We have had interest from interested bodies in Whitby who are looking at potential of a warming center within their facility. What's the prospect of that happening in this year? Is that a possibility? I know that there was other issues and training and everything that needed, and even the service provider.
I'm already in contact with them, and we will be looking at how we can use the facility. It's also important to note that when we look at service providers, that they have the expertise to deliver the service.
Yeah.
So although we may have space and agencies or, faith-based agencies might even step up and support, we need to make sure that the service provider has the expertise, the training for their staff to be able to have that oversight overnight. So absolutely.
Okay, thank you. And lastly, and I know I shared this on our review with the region this past week, but the opportunity last Saturday to be present for the building of the community gardens with the residents of 1635. And just even sharing of the stories, but the prospects of the future and what they shared as, the residents shared as what they would like to see as future potential. It was very heartwarming, and it was when we had the committee, the whole meeting where we had lived experience in the two individuals that came to speak. And the one gentleman spoke about that hope. I saw hope on Saturday. And that's very positive. Even the illustration of the artwork that is there, but there's so much that that we can do in the moving forward, and even looking at job employment opportunities as well too. So thank you very much for the work that is being done. And Mayor Carter, I hear you loud and clear. Your frustrations are not my frustrations within the community of Whitby. We experience different. You have different, and I know that. And I think that we need to be looking at that bringing together of how we can resolve some of the issues. So we'll take that away, and we'll take away also for updates as well too. So thank you for your presentation.
Thank you.
I'm going to move now to health, and we have one report. Can I have a mover? This is Mayor Carter, Chair Henry. Questions? All in favor? And that's carried. Next, moving on to the social services reports, and this is 8.2, authorization to extend. Can I have a mover? Councillor Brenner, second. Mayor Carter. Is there any questions on this? Hearing none, seeing none, all in favor? That's carried. And we're just going to move along, and right to September 5th is our next meeting, and I need a motion of adjournment. Oh, all right, other business. Chair Henry.
So, Madam Chair, just some latitude. I subscribe to all the Durham Regional Police media releases. And there's a couple this morning that have come to my attention. And I'm going to say that this is how bad the system is failing. We see things every day and we say, oh, that's just, you become complacent, and we should never become complacent. For the public and staff listening today, we actually had an individual who attempted a carjacking of a police officer. Now, you can go into the report and you can read that the individual was charged with robbery, attempt to disarm a peace officer, assault of a peace officer, failed to stop, dangerous operation, and breach of probation twice. And guess what? He was held for a bail hearing. Now, you know, we shouldn't, and we should talk about this, and should take the time to really follow some of what's going on there. But we had a traffic stop, and this one's interesting. The individual was charged with possession of a restrictive prohibited firearm, knowingly not holding a license, possessing a firearm, knowing the serial number has been tampered with, occupy motor vehicle with a firearm, possession contrary to an order times 6, possesses scheduled substance for the purpose of trafficking cocaine, poses Schedule 1 substance for the purpose of trafficking an opioid, and failed to comply with an undertaking times 2. Second individual that was in the vehicle was charged with possess a restricted firearm, knowingly not holding a license, possession of firearm knowing the serial number had been cut off, tampered with, occupied a motor vehicle with a firearm, possesses Scheduled 1 substance for the possession purpose of trafficking cocaine, substance for the purpose of trafficking an opiate, failed to comply with a breach undertaking. Both were held for a bail hearing. Madam Chair, we wonder what the cost to society is and how we continue to go around in this circle. But in the second one, if you read it, there was children in the car when the car was stopped. Now, we get these every day. And I would wish that all members of council subscribe to the media releases, that we ask the questions to our MPs, how have we failed? You know, in my lifetime, I don't remember having homeless people in Durham Region. I'm going to ask staff if they can help me with this. But when did we have the first truly homeless person in Durham Region? Do we know?
We always have had,
We've had
but
street people.
not
Because-
evident, because I know of a couple who have resided in Whitby for
But-
years.
In fairness to Mayor Carter, when I was the mayor of Oshawa, we knew the people living on the street by first names. That you go into St. Vincent's to help with dinner one night with the charities that are doing that, and you'd know the people in the room. We don't know the people any longer. And the system is so bad that in communities that have no support, especially the northern communities and the small towns, that the people that need help migrate to the southern part of the lakeshore communities where support exists. And yet, no matter how hard we try, Mayor Carter and Mayor Roy, to raise the message about the challenges we're having, nobody hears us. And you know, I would be curious, so this is just allowing me the rant and some latitude, that if staff could get me the information for the leaders of this country at the federal level and where their ridings are located, I'd be curious to know what their homeless rate is. I would like to know the supports in those communities. And I would like to know if the mayors of those communities are advocating with the leaders of this country to talk about that, because they definitely don't care what's happening in Durham Region. I'm positive of that. It's frustrating. And for our police service and our paramedics, and the repetitiveness of the individuals, for a small group of people to take the amount of money we're spending to manage this, and we have no solutions, and the taxpayers have had enough. Property taxes were never designed to deal with the challenges we're having today. And we've got roads that need to be repaired. We've got daycares that need to be built. We've got things that we need to do to advance our communities and create the jobs that are needed. But with no help, no direction, no guidance. You know, in your community, Mayor Roy, your people come to you as the leader of that community here, and the same for Mayor Carter. And here are the people that you come to me for that leadership and guidance. And I go to the other levels of government and I hear crickets. That is so wrong. And until we get the ear of our leaders at the other levels of government to talk about the challenging and the spiraling of society, I know that I'm not sure about Councillor Brenner. I know Councillor McDougall. I know that he's definitely not a grandfather yet. But for the three of us in the room, you're a grandfather yet, Councillor Brenner? Twice? So for the four of us in the room, when we think about tomorrow, we think about tomorrow for our grandkids and where we'll be 30 years down the road, where we'll be in 2051. And we've got a plan to meet our growth, but there is no plan to deal with homelessness, mental health, and addictions. You know, this country was built with a great vision. You know, when we build a building, you have a plan. You have a set of drawings. You have a schedule on how you're going to do that. Where is the plan for homelessness, mental health, and addictions for this country? Where is the schedule of how we're going to implement things and where we're going to go forward? I know that we have members of council at FCM today, and I know that we have members of council going to AMO. Mayor Carter, thank you. I hope you convey only the way you can convey the challenges of mental health, homelessness, and addictions at your large mayor's group. I do the same thing at Marco. I meet with the other leaders along the lakeshore. We do the same thing, and we hear each other and we listen to each other's challenges and we work on solutions together for our communities. But we're one cog on a big gear. And you cannot continue to think that you can fix this by hiring more outreach workers, more police officers, more paramedics, more firefighters. And people talk about the increase in the number of people that work in government. You might want to compare that to the increase in number of frontline services created by the lack of leadership that we have coming from the federal, particularly the federal level of government that controls the judicial system. So I will continue to advocate on behalf of council. I will continue to try to get the ear of our leaders in Ottawa. You know, hopefully during the upcoming federal government's election, as the MPs are coming to your communities, that you can raise your community voice so they hear you. You know, we get a little bit of support from our MPs. In Whitby, you do very well but the other communities I'm not sure about. So that's my rant. But today, the media releases, and you know, I save every one that comes in. And when I get time, when council's not in session in June, I will pull a spreadsheet together so that I can have something that I can give to those candidates running in the next election and say, these are the things that you're going to need to fix if you think Canada's going to continue as the great country that it is. Sorry.
No, it's all good. The likelihood, though, is we'll probably have a provincial election first. Rumor has it.
Feel free to share.
Councillor McDougall.
Thank you, Madam Chair. As a guest here today, allowing me to speak, I just want to say thank you. Thank you to staff for organizing the Bike to Work Day today. It's a privilege to be able to ride today. You know, for many people, biking to work is actually a necessity. They don't have a car, can't afford. So for those of us who, you know, can ride down to the region and participate like this on a day like this is great. On a personal note, On a personal note, 10 years ago today, I was actually in a coma fighting a strep A infection that lasted for about 45 days in hospital. And if I didn't bike to work and do all the things I did, and if I had any comorbid factors, my heart wouldn't have been strong enough to make it through that journey that I made it through. So it's really important to have the availability for people to use, you know, active transportation, bike to work, etc., and stay fit, stay healthy, because someday they're going to need those faculties. Anyway, thank you. Thank you to the region for taking care of that.
Thank you, Councillor McDougall, and we're glad you're here today. I do have a suggestion, and And we have had the discussion just about bringing the minds together. And I know that you will see an invite from Mayor Foster and myself. And it was something that we started just at the beginning of this term, but was bringing the mayors together of the communities. And Mayor Foster is taking the lead on this one to bring all of us together with yourself, Chair. But I think now it's that positioning and bringing statements together collectively. And I know we sit at, like next week we'll be at Ontario Big City Mayors, and you're at Marco, or we're at AMO, or at FCM. But the reality is that for Whitby and what we have within Whitby, it is not what you have within Oshawa. And don't think that I don't recognize that what is taking place in Oshawa, because I do pay attention and I do go along your streets and take a look at what is happening. And when I hear your complaints, I actually go and physically go take a look myself. But knowing what's happening within Ajax and what's happening within Pickering, and how our communities are changing to the south, but to the north as well, and knowing what those numbers are within the north and what is happening. But it's like even the first presentation, or the second presentation, to get that phone call about the senior couple who's being kicked out of their daughter's house because the boyfriend has moved in and they have no place to go. It is one where, as we're talking about it, it is a healthcare issue, mental health, opioid addictions. As you know, my daughter goes to school in Halifax. We see it right out front of our door, and I'm monitoring it. It's like what is taking place even within Halifax as well too, and in Vancouver. And it's to go along Hastings, East Hastings, and to see, we don't want that. And how can you not physically know and see what is happening within your communities? Because it's right there. Queen's Park, it's right in the front door. Ottawa, it's in their front door. They see it, they walk past it. But all too often, people walk over. And for the region of Durham, we need to take care of ourselves first, I think. I think that collectively with the mayors and yourself, I would hope that we can bring together some platform issues that we want to be heard loud and clear. So I do hope that the opportunity for July 4th works for some, but I think that the sharing, it's in the, it just came this morning too. I don't think you saw that. But, okay, you're away? All right, let's speak to Mayor Foster. But motion to adjourn. Mayor Carter, Councillor Brenner, all in favor. Thank you.